Good evening, everyone, and welcome to the MicroPen EVO webinar, An Evolution in Microneedling. I'm the VP of Sales for Eclipse, Shane O'Brien. Excited to be joined today by Dr. Amelia Hausauer, board-certified dermatologist from the Bay Area in California. Before I introduce Dr. Hausauer, I'd like to give everyone a quick introduction to Eclipse and give you a technology overview of our latest FDA-cleared product, the MicroPen EVO. A brief background on Eclipse for those of you that aren't familiar. Eclipse was founded in 1993 by two brothers, Tom and Paul O'Brien. To this day, Paul serves as our CEO, and I'd be remiss if I didn't give credit to former CEO Tom O'Brien for directing us in the future with best-in-class devices and products that include Eclipse PRP, Votess hair nutraceutical, Dermaflex microcannula, Evive shockwave therapy, and now, of course, the long-awaited MicroPen EVO, which fits perfectly into our company mission to help physicians prosper with innovative, affordable technologies which exceed patient expectations. I thought it'd be important to give a quick little background of kind of the journey we've been on with the MicroPen EVO. And so how did we arrive where we are today here with the FDA clearance in 2021? Well, many of you know the story, but it's important to understand that MicroPen EVO is not just another Johnny-come-lately microneedling product. We launched the first cordless medical-grade microneedling device with the original MicroPen in 2013 and followed that up with the MicroPen Elite in 2015, which many of you have used in your practices to this day. As many pioneers experienced, we ran into a regulatory challenge along the way, as all microneedling pen companies did at the time, when the FDA looked at this space and decided that because microneedling technologies were, breaking the skin barrier, they needed to apply for a Class 2 FDA clearance. A year and a half later, the FDA came out with guidance for us to do so. And what would have been devastating for most companies ended up actually being quite serendipitous for Eclipse. We took the MicroPen Elite off the market, much to the disappointment of many of our customers, but allowed us to put more focus on growing our PRP business, which actually tripled during that time. We then went into R&D mode on microneedling, and we feel strongly that we now have the finest device on the market. The EVO has the benefit of looking at all the things that people liked and what they didn't like about their existing microneedling devices, and we took our time to roll it out to make sure we improved upon those devices in basically every way. We are now poised as an organization to earn your business back and take the market by storm. And we're actually proud to report that we have, at this point, over 1,000 medical practices that have now brought on the MicroPen EVO. The point of today's webinar is to offer an exclusive trade-in program to those in attendance and give everyone on here a chance to hear from a physician that is a longtime Eclipse customer, now with several months of experience using the MicroPen EVO. So the EVO went through a rigorous testing process and has been built to really the highest standards in order to get that FDA clearance. And our R&D team of engineers led us to a new design which feels great in your hand. It's lightweight, ergonomic, it's metal, and it glides incredibly smoothly across the skin without any kind of dragging. And of course, we've now obtained that class 2 510K with our first indication for acne scarring in patients over 22 years of age. We also intend to file for additional indications to expand our ability to create marketing support for other applications as well. And we can share that link if we need to, if anyone's curious, to go ahead and look up our FDA clearance there at the bottom. Finally, I'm excited to introduce our speaker here. So Dr. Amelia K. Hausauer is the Director of Dermatology for Aesthetics, a premier plastic surgery and dermatology practice located in the heart of Silicon Valley. Dr. Hausauer is also the chief editor and a major contributing author to the medical textbook PRP and Microneedling in Aesthetic Medicine. And so she has literally written the book on microneedling. And so we're really excited that she's our speaker here today. I first met Dr. Hausauer back in 2016 when she was working in one of the most sought after advanced cosmetic dermatology fellowships in the US while she was being groomed by a master in the field of cosmetic dermatology, Dr. Derek Jones. At the time, they were working on a study using Eclipse PRP, which was later published in the Derm Surgery Journal and has now become one of the most referenced PRP studies in our space. Since that time, she's taught several CME courses on that topic in particular, but also on microneedling, of course. And I'm happy to confidently say there really could not be a better speaker for the MicroPen EVO. If you want to ask Dr. Hausauer a question, please just look at the top of your screen, or if you're on your browser, you can scan across your screen and there should be a little button that says join conversation, and you can type a question into there for the Q&A, which we'll hold at the end of her presentation. And well, you can also direct message me if you want to get a question, and we'll pick a few of those out of there to make sure we can get to as many as humanly possible. And so keep those in mind. But with that, I'm excited to introduce Dr. Amelia Hausauer.
All right, thank you so much, Shane, for that lovely introduction. And I think this has kind of been a long time coming. I've actually had all three of the different evolutions of microneedling pens, as well as several other of the competitors on the market. So I have a pretty broad spectrum and base of knowledge using different microneedling. And this is actually the first non-CME microneedling talk that I've given, so I'm pretty picky. So I do encourage you all to ask questions when it comes to any clinical applications, and also what makes this pen, I think, very particularly unique in comparison to some of the previous generations and other pens that are available on the market. Just to give a little bit of background in terms of the framework for how microneedling works, I think many of us are familiar with it. It's also called percutaneous collagen induction therapy, basically meaning you are making controlled, precise micro injuries. So I think of this a little bit like a mechanized form of a laser. In a laser, you would use heat and energy to create very precise injury. Here, you're actually using a mechanical needle to create that same amount of energy, that same type of injury. And with those microneedles, you get an induction of wound healing, which increases your production of collagen and elastic fibers. That wound healing process, there's actually another theory that's been postulated, may be initiated by actually the very fine needles. When they puncture the skin, they change the membrane potential between the cells. So you actually get a change in the negative energy, and that ion flux may trigger a healing process without scarring. So that's really critical when you're thinking about microneedling. So interestingly enough, in the ASDS survey, where they look at, what procedures are trending, what are being done more often, in the other category, so this is the things that we think about, what might not fall under energy and light, what might not fall under injectables or body sculpting. Microneedling was the second most popular treatment in the 2019. I think if you look at the 2020, those numbers are actually going to go up. And go ahead to the next slide. And if you actually look at how that has changed over time, microneedling has increased 45%. PRP, interestingly enough, has gone up 97%. I've definitely seen that this year in terms of market growth. Threads have increased, and hair rejuvenation, which may include PRP or other therapies, nutraceuticals, other FDA-approved therapies, that's increased by 1,000% since 2017. So these are all treatments that are, really on the rise. They are something that are, as opposed to, injectables or laser therapies that are very well established. These are treatments that are continuing to become more and more popular. So what is really the market demand? And I think this comes back to, the pendulum always shifts between real aggressive treatments, something you might do once, have a lot of downtime, and then don't have to repeat it for a while, versus doing a series of less downtime, maybe a little bit less aggressive treatments, and how do you fit that into your daily life? And I think that pendulum is swinging more toward the less aggressive. In the COVID era, it's been a little bit unique because people have been able to have some downtime, especially when it comes to body procedures. But when you're required to be on camera like we are today, you still need to have your face looking its best. And so having something where it might take you off camera for a week plus is less of an option. And so patients are looking for things that are effective without taking them out of work for a long period of time. And microneedling, I think, fits really nicely into that. model. So when I actually put it into my schematic, I think of non-ablative lasers, and I put it in that same category. So there are very gentle non-ablative lasers where you may be pink for a day, and then you have a little bit of a, sandpapery type texture to your skin, but can cover all of that. There are procedures where you're pink for 3 days, which is typically what I tell my patients. With microneedling, you're going to be red for up to 3 days. And by 5 days, you'll probably be back to normal. But during that time, you can cover most of it with makeup. And then there are even some more aggressive non-ablative lasers. So I fit it into that kind of spectrum. And when I'm talking to patients about how that will fit into their life, the quick recovery, but still getting excellent results, that is how I frame it. The other nice thing about microneedling in comparison to some of the energy devices, that's not to say they're not excellent, is that your price per treatment is substantially lower. And so that may fit in to, maybe more appropriate for a millennial patient who's coming in for acne scarring, who might not have the same budget as somebody a little bit older. And so you can really have a nice broad spectrum of treatments that you can offer patients, and you often can couple them. There are some nice ways to use drug-assisted delivery, which I know is off-label, but for your microneedling, and you can create a package for a patient that really meets and exceeds their expectations, and that builds trust. So when we think about microneedling, I think it's nice to have this to take a step back and put it into perspective. We have the over-the-counter rollers that are available that I pretty much discourage all of my patients from getting, because there have been multiple reports of actual infection spread, not only bacterial infection, but there have been reports of zoster, so shingles, being disseminated all over the face with a home microneedling roller. There have been fungal infections that have been spread, and even using tap water after someone has microneedled at home, they were able to give themselves a mycobacterium, so like a tuberculosis type family infection, which are very difficult to treat. So I tend to discourage them because of safety. Then you can ratchet that up a notch and go to the automated pens, which go up to a depth, of typically from about 0.25 millimeters up to 2.5 millimeters in depth. And those are class 2 devices. So they're meant to be done in the office. And then there's even above and beyond that, there's a microneedling with radio frequency, much more capital equipment that's involved in that. Also typically has increased downtime. So we actually have a radio frequency microneedling device in the office. The patient will have a lot of swelling and bruising for at least a week. And so you can have all of these different options for a patient depending on their needs and how they might fit into your practice. All right, keep going. So that really brings us back to kind of the model. And interestingly, we talk about microneedling. It's referred to here a little bit as a gateway, and I don't think of it as a gateway in the sense that it's like the most gentle thing that you might offer, but it's a gateway in that you can give a patient a series of treatments. You can get excellent results using that as a monotherapy, and getting those results, you build trust with that patient, and then they're much more willing to try other things within the practice or perform microneedling in combination with some injectables or with other topicals. And so it's really a way that they can enter into your practice. You can get results that are predictable, and then you establish this relationship that you build over time. I work in a unique practice environment where there are 3 doctors. So there's myself, I'm a dermatologist, so I am largely performing non-invasive procedures. And we have 2 plastic surgeons, one who specializes in breast and body, and another who specializes in everything kind of above the neck. We also have several nurses who perform procedures. We have a PA, and we have an esthetician. So we run the gamut from like the least invasive, esthetician, skincare, all the way to the most invasive in our private OR. And so having a patient where they can fit into that wheel they can jump on anywhere along the way is really nice. And I think microneedling is a nice entry point for that. So that brings us into the EVO and a little bit more about how this differs from some of the other devices and some of the previous generations of the microneedling devices that you may have had in your office and loved and didn't want to give up. They had to pry it out of your hands like they did me. But I've been really excited to use the EVO. I actually think I was the first person or the first provider to use it in a patient treatment that we filmed for CME. And I was really amazed at just how ergonomic that handpiece is. So it has that gooseneck handpiece that allows you to really, instead of holding the pen directly perpendicular to the skin, you're holding it more like you would a pen or a pencil. And so it allows for much more ease of treatment. That gooseneck also allows it to be fluid resistant, so it's not what is being suctioned into, anything into the needles is not getting into the actual handpiece itself. And it also has the capacity, the cartridge pops in, but there's this ability to have a whole host of other different cartridges that may be coming down the line. It's kind of a hint, hint. You also have this nice battery that very easily swivels in, and you have a second battery that I always keep charging, because if you're doing multiple treatments in a day, it's nice to have a battery that you can swap out and not die in the middle of a treatment. I'll talk a little bit more about the actual cartridge itself, because I think that is something that really distinguishes it from the previous pen and from other pens that are on the market. So with the EVO, you have a pen that is moving at 7,000 revolutions per minute. The body is actually, and this was something I learned, it's made out of military grade, it's magnesium with military grade ceramic coating. So you could take a cavi wipe and wipe down that entire case and it wouldn't degrade it. Some of the pens that are on the market are encased in plastic. And so if you take a cavi wipe and wipe it down, you will actually slowly start to degrade and it will break down some of the inner mechanisms. So it's nice to have that real, very consistent and firm handpiece that you feel very comfortable sterilizing, not just using alcohol, but I feel like in the era of COVID, we cavi wipe like our walls and our door handles. So it's nice to be able to do it with all of the medical equipment. You also have the cartridge itself has these stainless steel needles. That's really important because there was actually a case series that was a systematic review that was published this year, and they reported on a number of different adverse events that occurred with microneedling. The two biggest things that came up were knowing what your needles are made out of and knowing what you're putting on the skin in combination with your treatment. And that is because there have been a number of cases where patients have been treated with needles that contain nickel, and nickel is the most common metal to have an allergy to. And so patients can have an allergic reaction to those nickel needles. So having stainless steel needles is really important. They're 32 gauge, so they're very fine, hair-like needles. There's 14 of them, and they go up to a depth of 2 millimeters. If you actually if you look at the adjustable tip, which is very easy to look at the numbers because it's offset. So when you're holding it in your hand, you can see these numbers when you're twisting it really quickly and very, very easily. If you go a little past that 2 centimeters, you can actually get to 2¼ depth millimeters. All right, go ahead. I think those are the most salient points. And so with this, again, like previous generations, it's single-use sterile blister pack. So you're getting something that is very hygienic for your patient. Unlike a lot of other tips, it doesn't have the same suction. And so you get that really easy, gentle glide that Shane mentioned over the skin. So you're not getting, without that suction, you can move more rapidly and still get the appropriate penetration of the needles. The really, I think, kind of revolutionary or innovative, whoever sat down and thought about the way that they were going to put together this pen was very creative. And having that pen offset with the gooseneck allows for you to actually take that tip of the handle, and you'll see it in a little video here, and you push it right into the blister pack. So if you hold the blister pack on underneath, this is like the tip that I learned, holding it underneath, you push it in, it snaps in directly without you ever having to take it out of the pack or ever putting your hand near the needles. So that's a nice innovation when you're taking something on and off, to not have to put your hand near, you know, the on button and the needles and you be worried about a needle stick. As we said, there's really the easy to read depth markers because they're offset, and the fluid transfer doesn't go back up into the handle because the handle is offset as well. You have your adjustable cartridge depths, and that really precise depth with very, very consistent results. And we're going to see some photos that I think will kind of convince you more of that in a moment. So go ahead and move forward. The other thing that comes with the EVO that my patients have really liked, and I think it's taken a little bit of the guesswork out of some of the microneedling treatments, right? Because you're creating these very controlled injuries in someone's skin. So as soon as they leave the office, I no longer have 100% control. I like having control. I have it when they're in my room. I have it while we're doing the treatment. But as soon as they leave, they could put anything on their face. And so you get this post-care kit that you can provide the patient with. You know, there's Glide that comes that you can use with the microneedling, but then they get 3 different steps. You know, they get a wash, they get a soothing and a nourishing step that they can use in the first 24 to 72 hours so that you, again, have control over what they're putting on their face. They're not getting anything in those little tiny pores as they're closing up, which really can take a matter of hours, even up to 24 hours, depending on what studies you look at. And they're not just grabbing something off of their bathroom, you know, out of their vanity and putting that on as a supplement. The other thing that comes with it is this mask. It's a cooling and hydrating mask, and every patient I have put this on has been like thrilled, because you know, after you have any type of kind of non-ablative or ablative treatment, your face feels like it's been sunburned, right? It feels really warm, and so having something that you can lay over the face, just let them sit there and let the skin cool. Everyone has been very thrilled to have that. It's like a nice little added bonus. It also helps restore hydration in through those tiny pores. And so you're getting a little extra bang for your buck there. Keep going. All right, so here you're gonna see me put together the pen, and then I'm gonna do a partial treatment of a patient. So I'm gonna narrate you through. So this is right, like you would have in your previous or some of your other pens, you have this nice sleeve that the handpiece will go into. So you open it and you just pop it in through that sleeve. There's a little outlet window that will match up with that black square, which is actually where the cartridge is going to attach. And you remove the backing. And so then you see that little opening. That is where the cartridge will attach. So you open your little blister pack. And here's where you're going to see what you should ultimately do. So you just push it on. It will come off most smoothly and click in most easily if you actually put your hand on the back side of it to provide the pressure, and then it will come right out like that. So your hand is never near the needles. It is not near that sterile tip. So you're maintaining the sterility, and you're also maintaining the safety of yourself or your medical assistant or nurse or whoever might be assisting you. There's a nice, there's a button right on that, kind of on the handpiece itself. It's a little less sensitive than anyone who had the previous generation, which I actually find really great, because sometimes you would accidentally click that button and turn it on unintendedly, but this you actually really push deliberately, so you're giving a very controlled treatment. All right, go ahead to the next clip. Okay, so here I think we have the cartridge on. And you can see it pops off from the back. So I just lifted kind of the back part of the cartridge to get it to dislodge. So instead of pulling it off from the top like you would with many other pens, where you're holding the handpiece where your button is and you're pulling it off from the top, that's not done with the EVO here. You also have the post-care kit that we went over briefly that the patient will go home with. All right, now we can move forward to the treatment. All right, so this is our lovely patient. She does suffer from some acne. She actually had one active acne lesion on her chin, which I actively avoided while treating, so I don't treat over any active acne. My medical assistant has put the glide that came with this cartridge kit onto her skin, and I'm just gently moving horizontally, vertically, and I also you can go in circular motions. I'm doing this in a bit of a slow treatment, just so you can actually see the real movement and penetration of the needles. But the nice thing about the EVO is because it glides so smoothly over the skin, and because the needles are oscillating at a rapid pace, you're getting that penetration at a somewhat faster, quicker treatment. So you can get to your endpoint, so that pinpoint bleeding, which is typically what we consider your endpoint, much more rapidly than I did with the previous generation of pen. All right, we can move. I treat her for a while, so if we want to watch it, you can. And I typically I start at forehead. My personal preference is to start at the lowest depth. The forehead and the nose tend to be the area where the patient feels it the most, because the bony backing, you can feel the vibration against it, so it's a little bit not uncomfortable, but it's almost like ticklish. Same thing with the nose. It often will make people feel like they want to sneeze. So I typically will start with those areas that are lower depths, and then I'll move into areas of greater depths with acne scarring. Most of the literature shows between 1.5 and 2 millimeters or higher. And so when we get up into her cheeks, I'm going to go up to 2 millimeters, where she has most of her acne lesion, scarring lesions. And so I'm just applying gentle pressure because those needles are oscillating. They're going in and out of the skin. You don't have to push hard on the skin. When you push hard, there have been reports of tram track scarring. So it basically looks like little railroad tracks from excess force. So you don't need to have a really heavy hand when you're doing this. You can still get good penetration of your needles, much better than I think with other pens, because this has a very unique mechanism. So with many of the pens, what happens is the motor pushes the needles forward and they penetrate the skin, and then they retract on their own. And that's why you get some of this drag on the skin, and also there's a delay in the retraction. And so you have to go a bit slower. With this pen, they thought about it really carefully, and it's almost designed like a piston. So it pushes the needles out and it also pulls them in. So you're getting pushing forward and retraction, and that quick retraction allows you to move more quickly over the skin and get a much more uniform treatment. You're not getting the same, because the needles are also coming directly out vertically, as opposed to coming out slowly and your hand maybe moving forward. You're not getting drag on the skin where you can create collateral injury. And that collateral injury in someone not like this patient who is a Fitzpatrick type 1 and blonde, but in someone who is a little darker in skin type, that's where you may get more post-inflammatory hyperpigmentation because of the drag on the skin. And in that same meta-analysis and systematic review of safety in microneedling, and this was the first large review of safety for microneedling, even though we talk about it as a really safe treatment. And so it was really nice to see that published in the literature. And they found most of the adverse events were what you would expect: redness, bruising, a little bit of swelling, all resolved within a matter of weeks. Some patients had post-inflammatory hyperpigmentation that typically resolved within 2 weeks. They think that that typically occurred more commonly in people who used isotretinoin and in people who were using TCA, or anyone where you're having excess force on your microneedling pen. So that's why it's nice to have this light hand with that really precise insertion and retraction. Prolonged post-inflammatory hyperpigmentation was much rarer. And so that's nice to see that published in the literature, showing that this is a really safe treatment with very minimal, the side effects tend to be pretty rare. All right, I think that's all of the treatment. You can go forward. Okay, so I think we went over this. So what kind of distinguishes the EVO? It's a class 2 device, which is really important because that is what the FDA is looking for when you are doing an in-office procedure now, that you can no longer be using a class 1 device. Those are meant for basically anything that doesn't break the skin. So microdermabrasion, something that might be an at-home device. You're working with a company that many of you have potentially worked with before that have a reputation in the market. You have good company support. They're really invested in this pen, had spent years designing and engineering it and studying it. That very precise depth of penetration and adjustment in the needles, I think, is something that is really unique, especially in the way that the cartridge is designed. It charges quickly, and you always have that second battery, so you're never going to be in a quandary where you're like, okay, I have a patient and my microneedling pen has just died, so now what do I tell them we're going to do? The consistent power and performance without that drag and scratching, I think I kind of maybe hammered that home, but that is where I think, for me, the pen stands out for that reason, for the ergonomics, for the clear safety that we've talked about. It's very easy to clean. So from a kind of internal, the housing is very easy to clean. And from an internal practice perspective, you want devices that are not contaminated, that you can use between multiple patients, especially if there are any blood products involved. We said the great ergonomics and this low cost of disposables, both in comparison to other pens, but then also low cost of treatment and low cost of disposables in comparison to some of your energy-based devices. All right, move forward. All right, so this is a really interesting slide. So this is a patient who on the one side of her face was treated with the MicroPen EVO. On the other side of her face, she was treated with the same number of passes at the same depth with another FDA-cleared class 2 microneedling device. So you can see how much more consistent and the depth of penetration that you're actually getting just by noticing where, like, she has a pinpoint bleeding is on the EVO side in comparison to the other. Again, this high safety profile with the new cartridge, the tissue effects, because you're really, there's literature that says above 1.5 millimeters, we're probably not getting the depth that we anticipate. I think with this new mechanism, and this is where I got really excited, the new mechanism where it pushes forward and retracts, you're getting more of the anticipated depth than you would be otherwise. It's very easy to hold, like we said, doesn't drag. And because of all of these factors, you can treat more patients in the same amount of time. Each treatment, right, you can see, each treatment to get to your endpoint is going to be shorter, fewer number of passes. And so you're shortening your appointment times and you're getting through more patients, and they're still getting the exact results that you would anticipate. So you're not sacrificing results for time. All right, go forward one more. So here it is in comparison to the previous, the MicroPen Elite. Again, with the MicroPen Elite, you're still getting a really good treatment. You were just having to do more passes and it would take you longer. This is more powerful. I think we've really kind of hammered in the point that the depth of penetration is much more accurate because of this new cartridge. The safety profile, the long-lasting battery, those are the things that I really want you to take away from here. So if the big things, if you want to kind of boil it down, very ergonomic, so good for someone who is actually performing the procedure. And that's important because if you're doing a lot of these and you're holding them, you can end up with carpal tunnel, you can have wrist problems. So having good ergonomics is really important. Easy to see and adjust depth, so you know that you're giving the appropriate depth to the different parts of the face. The eyelid skin is 0.5 millimeters, it's the thinnest, and everywhere else I kind of base off of that. So when you are adjusting your treatment, you are getting the depth that you are anticipating, especially around the mouth down there where you can see she was treated at 1.5 millimeters. I will often go up to 2 millimeters for someone who has deep perioral rhytids. But you're getting good depth of penetration. So easy ergonomics, good depth of penetration without drag on the skin. So penetrating without collateral damage. I think those, and then this very, well-designed handpiece that is easy to sterilize. It is very safe between treatments. All right, go ahead. And I think we kind of went over most of these. So you have that 0 to 2, maybe 2.25 millimeter depth, very precisely. Battery powered, which I like because you're not tripping over. There's enough cords in my room. If I have to trip over another cord, something is not going to go well. Having that consistent, powerful performance with a real focus on safety, both for the provider, so taking that cartridge on and off, and for the patient. It feels good in your hands, which is really honestly probably one of the biggest things we think about. How does this feel when I'm using it? If it's something I can do day in and day out, that is really a big boon. And also knowing that this is something that you can offer in your practice. I think we haven't talked about this, and Shane may touch on it, but microneedling is a treatment you can offer for acne scarring, and resurfacing that has a much lower capital cost. So if you're starting out in a practice, or you don't have the room to buy a ton of energy-based equipment, a microneedling pen is something that is really easy to fit into your practice and give you consistent results and get good outcomes for acne scarring and for other indications like that. Move forward. All right, so this is what the EVO, this is the case that it comes in. This is the handpiece, the extra charger, and the battery. These are just some kind of implementation strategies that we have in our practice. We do not, when we bring something new in, we don't discount it. It's new, it's novel. Your expertise is something that someone should seek out, and you have this new cutting edge technology. So don't discount it. Just, talk about it as something that's innovative and why patients should be excited about it. Schedule, a launch party or some big kind of, if you're on Instagram and that's how you communicate with your patients. I have a big, Instagram page where I post a lot of before and afters, as do my partners. So we often will say, oh my God, look what just arrived at the office. And a lot of patients will call because of that. So tap into your existing patients and have them bring, a friend, have them explain to them what this new device is and why they might use it, and how they can use it in combination with treatments they may already be doing in their office, or if it's somebody new who's coming in and seeking treatment for acne scarring, use that as an entry point to talk about some of the other things they may potentially benefit from in your practice. All right, move forward. And so just a couple clinical pearls. These are things that I think about when I'm doing any microneedling treatment. So because you are penetrating the skin, and this is, I think, why they really made that post-care kit, right? Anything that you are putting on the skin, you are now putting in the skin. So think really critically about whether someone might have an allergic reaction, whether you think it is, medical grade sterile. So those are little individually packed. So every time they squeeze it out, you're not putting your hand in a big tub of Aquaphor and then slapping that on your face and with all of its germs. So anything that you put on the skin, you're putting in the skin is my kind of rule of thumb. You can treat darker skin types. I actually don't pre-treat all of my darker Fitzpatrick darker skin types, 4, 5, and 6, which I do microneedle quite frequently. I'm in the Bay Area, and we have a really diverse population. We have a lot of Asian, Hispanic, African American patients. I don't pre-treat all of them with hydroquinone unless they have a history of melasma or they have a strong history of post-inflammatory hyperpigmentation, whether that's even from just like cutting themselves or a bug bite. I ask those questions, and then I will pre-treat someone for like 2 weeks prior to treatment. I will then microneedle them. I'll have them use their post-care and start the hydroquinone after. Obviously, you want to be training, you want to get good training before you start combining these with other modalities. There's lots of ways of making combination therapies, either with, I have a close colleague who combines IPL and microneedling because she says, I can get really good sunspot treatment, and then I can get really good resurfacing with of acne scarring with the microneedling. So there's lots of ways of combining them, but you want to have a really good fundamental base of using the pen before you do that. And I always book patients in series of treatments when they're starting, especially with acne scarring. So I tell patients they're going to need between 3 to 6 treatments, depending on the degree and the depth of their acne scarring and the severity. I will sometimes combine that with other therapies, like subcision is something that we classically use for acne scarring. And I will tell them that they need to book that series. If you do one, you're not going to be happy with the outcome. So I think if you really set that expectation from the start, and they know how often to come and how, what to expect along the way. I talk to them about collagen building, right? We're trying to stimulate your body to make more elastin and collagen. That building block process takes up to 3 months, even 6 months for some of those elastic fibers to mature. So you're going to see a lag in your results. And so when you have a patient that's coming in incrementally, like every month for a series of treatments, you can hold their hand and tell them, yeah, you may not be seeing the treatments you expect yet, but by the time you get to the 3rd one, you're really seeing treatment effects from your first treatment, and then it's going to get better from there. So walking patients through that series and how to maximize their satisfaction, I think, is really, really important. All right, move forward. And then I guess this is a plug for my book. So I was the lead editor on a book that came out, I guess, 2 years ago now. I don't know, with COVID, all of the time is gone. On PRP and microneedling and aesthetic medicine. I actually wrote the chapter on the mechanism of action for microneedling. So it's an in-depth chapter. So if you want any other literature to kind of augment this and the CME, there's several CME courses. There's one that I have taught that through Revive that really goes over some of the nitty-gritty of the clinical using the MicroPen. It actually is the MicroPen EVO. These studies and these publications all came out with the MicroPen Elite. So it's, they're a little bit of a generation behind, but there was a publication by Tina Alster in dermatologic surgery. There's textbooks. There's a lot of resources if you want to expand your knowledge in this field. All right, go forward. All right, and so this is a patient of mine. She had acne scarring that was, I want to say, like 20 years old, and she had just said nothing really helped her skin quality. And so you can see around her kind of nasolabial fold, up onto her cheek, down into almost this like that jowl area, the quality of her skin and that textural change. This was with 3 treatments of microneedling only. They were separated a month apart. And this is actually her at the 3rd treatment. So she hadn't received her 3rd treatment quite yet. And her results actually got better and better after this. And she now comes in. So we did this series of treatments. We actually did 3 treatments a month apart. And she now comes in twice a year and does microneedling just to maintain her skin, because she's like, I can't tell you how much it's changed my entire complexion. I don't ever want to go back to where I was. And I'm like, well, your acne scarring, if you're not breaking out, isn't going to come back. She's like, no, I'm coming forever. I'm doing this twice a year as a maintenance. And so I've been seeing her for 4 years now as maintenance therapy. And her skin has just gotten more dewy and more glowy over that entire period of time. And I think that's really interesting because during this whole you know, with the shutdown, there was this big emphasis on skincare and how to get kind of the most even complexion. And so people were really investing in products. And so they're also interested in investing in treatments. And I think you can really take that point and that motivation that they had when they were at home and use that in the office. Go forward. All right, so I think we're going to answer some questions. If I don't get to all your questions, you're more than welcome to send it to me. That's my Instagram. I have before and afters of microneedling. I think I have like bloody pictures of patients who were treated, microneedling pictures, and then that's our website, our practice website. So
yeah, that's great. Thank you so much for all of that, Dr. Hausauer. That was great. We do have quite a few questions here, and quite a few that have actually been messaged to me as well. So I'm going to get to as many of them as we can. We're going to try to get as close to the end of the hour and not have this go too far into everyone's night. And so if we do not get to your question, we can certainly circle around. I'm sure Dr. Hausauer would be happy to hear from you from Instagram, and your rep would be. We have some advice for questions too.
All the reps can, I was going to say, all the reps can also get in touch with me. So if you ask your rep, I'm pretty speedy at answering questions over email as well.
Yeah, perfect. So one question that we do have here, and maybe kind of relates to a couple others that are on here. First one is, what is your thought on stamping technique? And another one that I'm thinking may relate to that is, what is your typical acne scar protocol?
Okay, yeah. So
spacing wise, I think is what they're asking.
Yeah. So my acne protocol, you know, I said, so I usually will say between 3 and 6 treatments. In terms of like depth of penetration, I typically will do about 1 millimeter on the forehead. When I come around the orbital rim, I'll go up to 1.5 millimeters if someone has crow's feet. Being careful right at the orbital rim, because you can actually give someone quite a little bit of bruising there. And then as I get lower into the face, down into the cheek and perioral area, I'll go up to 2 millimeters. Anywhere that someone has scarring, acne scarring, I will typically use a 2 millimeter, or I'll try and crank it a little past that 2 millimeter depth, because scar tissue is formed by collagen bundles in parallel. So they tend to be thicker, they're harder to penetrate. So you want that deeper depth of penetration. I usually will use kind of a circular motion because I feel like I can get a really nice, consistent coverage of the face, except in an area where someone has very deep scarring, particularly ice pick scarring. And then I will use a stamp, like almost like a stamp, where I'll let it kind of just oscillate right on top of that area so that I know I'm really penetrating deep underneath that scar and trying to break up some of those collagen bands that are tethering it.
Yeah, perfect. One that I did have messaged to me here is, and we tend to get this question because they were the first to get the FDA clearance, but how does this compare to the skin pen?
Okay, yeah. So in full disclosure, we have the Elite, the EVO, and the skin pen in our office. So I've had a lot of hands-on experience with all of them. My personal opinion is that you get a much smoother treatment with either the Elite or the EVO, and really in particular with the EVO, which has been very impressive to me, than you do with the skin pen. When I was going up to, 1.5 millimeters, 2 millimeters, and then their pen goes up to 2.5 millimeters, anywhere above 1.5 millimeters, you can actually see, you get drag on the skin. And so you, instead of getting little punctate marks, you get almost these little teeny tiny linear marks. And I think with that, patients were having a lot more discomfort because that pull on the skin is just not pleasant. And then you also have a much higher risk of post-inflammatory hyperpigmentation.
That's great. I was going to just maybe chime in a little bit, just because it is sort of like a design element to it, and just having been a part of that whole process. But as we kind of talked about a little bit earlier, we were able to, that was definitely one of the pins that we kind of looked at to say, okay, what could we improve upon an oral device, the other ones that are out there. And One thing that we have to show, that we actually had to show the FDA, was that we cannot pull fluid into the shell of this pen. And every FDA cleared device is to be able to pass that test. And as Dr. Hausauer talked about earlier with the sort of angled design, the way that Eclipse does that differently than perhaps that device is we did not build a bunch of locking, since it doesn't pulse towards the actual pen itself. We did not have to build a bunch of locking mechanisms into the cartridge itself. We often hear about people kind of getting locked out of that cartridge maybe, or that's kind of difficult to put on there. I'm kind of just demonstrating here, even on my screen. Just we made this thing as easy as humanly possible to just snap that cartridge on, and then just having those removable batteries to be able to, if you're ever running out of, if you have back-to-back patients and you start to maybe run out of battery, we know that we always have a backup ready to go. These do last for 4+ hours of straight running the battery. So that's usually several patients back to back that you get. We've actually have run these batteries for about 8 hours straight without them shutting off. And so it's a really high quality battery that's on it. Of course, it's metal versus being a plastic device. And outside of that, we've kind of just built it with sort of that functionality with the cartridge that has really just been a much friendlier design and kind of having that angle to it as well. But kind of the main thing that we like to hang our hat on is that we actually can get to that. We saw that sort of split face earlier. We can get to that result, that response in the skin rather, much faster than any other device. We're quite confident in saying that because of the design of this cartridge, which we didn't delve a bunch into, but I did hear Dr. Hausauer say the piston that's kind of pushing that in. This uses a cam and shaft delivery of that rather than a spring-loaded or a bouncy cartridge that's going to kind of bounce those needles on the skin, and typically is what leads to the dragging. And so we can move this handpiece quite fast. You saw at times she was moving it pretty quickly. We can move this thing really fast and still get that response in the skin, which we're aware of is important to our practices, because that's going to put a lot more money in your pocket if you can stack a lot more patients back to back, or maybe get onto other treatments much faster. And so I don't want to just chime in on the device aspect.
I think that's really important. I think the fact that you can, the design of how the needles are penetrating and exiting the skin, that allows you to go much faster, which is quite different. And then I have a nurse in the office who, every time she used the skin pen, she would literally lock herself off the cartridge. So you go through 3 cartridges in one patient, and I'm like, okay, this is not cost effective at all. So if you can see more patients and have a really, easy, safe way of putting on that cartridge, I think that distinguishes it.
Right. Another question here. I don't know if you're familiar with this device, so I can chime in if necessary. But how does it compare to RejuvaPen? Are you familiar with that?
I am familiar with RejuvaPen. I have not used it as much as some of the other devices. So I would let you, if you have thoughts on it.
The main difference is no cord, and ours is not plastic. And those are kind of the main things that would pertain to that device. I saw another question on here. We often get the question about, do I need a cord to be able to get enough depth of penetration and to not get any dragging or anything like that? That's a pretty old school approach that I think we kind of, even with our old device, got rid of that myth. And so what's really important is the motor that's inside of this, as well as that sort of piston delivery of those channels going in and those channels going in and out of the skin.
Microneedling it's not actually a new treatment. It's based on decade or century old Chinese therapy. And so, with the very early generation pens, you didn't have enough power in a non-corded, right? They just couldn't create a motor that was powerful enough. We're way past that. And so having a non-corded device, I think, makes it much easier. It's you can move easily from room to room. There's nothing that someone might trip over. And you can get a really consistent, good treatment without worrying about that cord.
Perfect. Let's see if we've got any others that we might want to hit on here. Do you apply topical anesthetic prior? For how long?
Yes, I do. So we have we get a compounded topical anesthetic that is and this is what I use for laser as well, 23% lidocaine, 7% tetracaine. So it is very strong. I will not let patients use it on more than 2 body parts at a time. So you get like face and neck. If you're microneedling your face, neck, and chest, you have to numb in stages because it's quite strong in terms of lidocaine, so risk of lidocaine toxicity. And I typically will have patients numb for about 45 minutes. When they do that, they do not feel they do not feel the treatment. They can feel some vibration, but nobody complains of discomfort, even when you're at maximal depth or you're in areas that are scarred or otherwise would be sensitive, like around the mouth.
Yeah, perfect. And I guess, well, I've given you already more than I thought I would, but I'll wrap up. I think I missed one here at the very top. And I can even answer this really, but so just can they use the Soothe serum on the night of the procedure? We've actually designed that for post-procedure, and it does have the same as what's in the mask, which we put on right after typically. But I don't know if you'd have anything to add to that in terms of your post-care.
No, I tell them to use it because oftentimes when they go home, they feel like, right, you have like a sunburn and your skin feels dry and dehydrated. So you want something that you can put on immediately. So I tell them to put it on that night. We usually put it on them before they leave the office. Like I open it up and I'm like, this is what you're going to use. You know, we do your mask, then I'm like, this is what you're going to use. I put it on their face. I'm like, go home, put it on tonight. I want you to be like a glazed donut for the next, 48 hours. It will facilitate your healing much faster. So I walk patients through it very, very step by step.
Perfect. Well, I think that's probably about all the time that we have for all the questions. And we'll move on here. We'll go ahead and here in just a second get started on kind of more the business side of things and kind of show you guys what we're offering in the cartridge and consumables and all that kind of stuff. But thank you so much for your time, Dr. Hausauer. That was really fantastic.
Thank
you. You're super knowledgeable. And so we really appreciate you for giving your night to us.
Thank you guys for having me. And it's always fun. I think very deliberately about any type of device or injectable that I speak on. And so it's been a real pleasure to talk and to get to become familiar with this new evolution of the pen. So
awesome. Well, I'm sure if we didn't have everyone muted, you'd be hearing clapping right now. So thanks so much. You have a good night.
You too.
All right, guys, so we'll move on here and just wanted to share a couple of quick things just so you guys know what you're getting in each one of these our reorder options when you do get. That's a really common question that we do also get. And so on this slide here, you'll see we provide 2 different options, okay, when you're ordering the consumables for the EVO. So what you're looking at here is the EVO in treatment plus post-care kit. Each box includes 12 needle cartridges, 12 peptide serums, sleeves, and all 3 of the steps of the post-care for you to send home with the patient. We're actually getting a phenomenal response from our practices whenever they get feedback on that kit from their patients. And so highly recommend. This is where a lot of our practices, there's 1,000 or so pens that are out there already. Most are reordering with this post-care. But we do offer another option. So these come at $9.95 if you order just 1 box, and then 2 or more, you get them at $900 a piece. The second option is basically everything I just listed before for the in-treatment portion of things without the post-care. And so we don't twist your arm on which option you want to use. And this should be actually the most price competitive kit in our class for a microneedling device. And so these are at $660 a piece. And then of course, if you do that same price break of just 2 or more, that's all we ask as you get down to that $600 mark. And I'd be remiss if I did not mention, we do have a lot of PRP customers that I'm sure on this call. Huge value add for going with Eclipse is we do offer 10% off of your entire order whenever you order at least a box of cartridges and at least 12 PRP kits from us if you do that order at once. And so you get 10% off of that entire sum. So you can imagine, you order quite a few PRP kits and quite a few of the cartridges, that you may save a few $100s on just one order. So that's a huge value of just having this all under one umbrella with Eclipse. So we'll quickly go over the initial. This is our typical initial startup package. If you do not have a trade-in device, we do recognize that microneedling is, it's becoming a mainstay treatment in just about all of our practices. And so a lot of you do already have an FDA cleared device. I'm going to show you here in a second the promo that we're doing exclusive to those that are on this webinar, if you do want to trade out your existing device. And so, but this is our typical package to get up and running. It includes the device itself. It's $59.95, includes the device itself, 2 of the lithium ion batteries, the induction charging base, and 12 of the treatment plus post-care kits. And that comes with a 2-year standard full replacement warranty. So the pen breaks on you for any reason, we don't just have you send it in and we repair it, send it back. We actually will just swap it out for you so you can keep up and running. And we are running a promo on this right now. We're not going to be announcing it on the webinar, but if you do not have a device to trade out, then get with your rep and they've been equipped with that particular promo that they'll let you know about.